Hey everyone, my name is Manu Kalia. I'm a physical therapist and Ayurveda herbalist. So in this video, I wanted to share with you some simple tips that I teach my patients to help them manage their low back problems. 80% of the population is affected by low back issues, so this is a really important topic, I think. So first of all, you have to remember that no single low back issue or problem is the same. Okay, every condition is unique in its own way. So first you have to understand that concept, and that's very important. And it's very important as a patient or as a person who's suffering from a low back problem to understand their specific low back issue. What aggravates their symptoms or increases their symptoms, and what alleviates or relieves their pain or their symptoms. That's very important to understand. Okay. Remember, the body is going to do healing on its own time. The body will heal itself. You have to give it the right environment to heal in, and that's what most people don't seem to understand or do effectively. Okay. You can't speed up the process. Medication and things are going to make life more comfortable, but they're not necessarily helping address the underlying issue. So what are some of the things to think about when you're looking at low back problems? So the first thing to remember is whatever aggravates the problem or increases the problem, you have to stop doing that. So I always tell my patients, if I take a hammer and I continue to hit myself with the hammer and I don't stop, does that give the tissue time to heal? It doesn't. I keep aggravating it, keep injuring the tissue. It doesn't allow it enough time to heal. Most people tend to overdo it, keep going, even when they're hurt or injured. This is what I find. So it's very important to really figure out what things are aggravating the problem. So you want to think about it as, is the back sensitive to load bearing, right? Has load sensitivity. Meaning if I put more load on the system, whether when I'm standing, sitting, walking, any of those activities, loaded activities, does that increase my problem, right? So when gravity is working on your system more, does that cause you more pain? So if it's load sensitive, I have to unload the spine if that increases my problems or pain. So which means I might need to unload it or lay down, right? Unload the spine. So lay down, or in physical therapy, a lot of times we'll do traction for the patients, right? Whether manual or mechanical traction. And the patient can be taught how to do self-traction also. So unloading can be done laying down, whether you're laying on your stomach, on your side, on your back, any of those positions. So basically you're taking the pressure off of the joint, the disc, the nerve, and the local structures. And that's what it's asking for. Okay? So first concept to think about is whether it's load sensitive or not. All right? So if it is load sensitive, you got to get out of those positions. Second thing you want to think about is it stasis sensitive? Or is it movement sensitivity? So stasis sensitive meaning it does not like static positions. So it doesn't like one single position. So if it doesn't like sitting in one place too long, or standing in one position too long, or for that matter, laying down in one position too long, you have to change positions. You have to get out of the positions. Okay? Or if it doesn't like movement-oriented things. So if you do excessive movement or excessive activity, and it aggravates your symptoms, you got to stop moving so much. Okay? And moving doesn't just mean exercising. It can also mean just day-to-day things. I decide to, let's say, do laundry, I decide to do vacuum the floor, I go out and get groceries, and all these things add up as activity. So if I'm doing excessive activity and it aggravates my symptoms, I must reduce the amount of activity I'm doing, right? To give the system rest or time or break to it to heal itself. Okay, so it's very important to understand that principle too, because it's not always that, oh, you do more when you have low back problem, everybody gets the same exercise. You have to do exercise, you have to exercise. It depends on the condition, the stage of healing it's in. Okay, so it might need to be left alone to rest first, to settle it down, settle the irritability of the disc, the joint, the nerves, or the nervous system down first. Once that settles down, and then you can initiate movement and exercise and all these other things too. Okay, and on the other part, of course, as I mentioned, if it does not like static positions, then maybe getting the person moving a little bit more. Okay, So the next thing you want to consider is whether the person is flexion or extension bias. Flexion bias meaning they like more rounded positions where the spine is rounded. So for example, if you're sitting down, your spine is going, lower back is going to be more rounded. And extension bias would be when you're standing for that, for example, because your back is straight or more towards an arched position. So if you're flexion bias, you like more of those rounded positions. That could be sitting down, it could be squatting, it could be laying on your side in a fetal position, right? So those could be all more flexion bias positions. Maybe the spine likes those positions. Or if you're an extension bias condition where the spine likes more extension, person likes to be more upright, standing, right? Or laying down on their stomach. So all those positions they tend to do better with. So it's very important to understand which of these positions or activities or loaded or unloaded positions the back responds to or doesn't like. Okay. Once you start to understand that, then you want to implement avoiding those aggravating positions and doing more of the non-aggravating positions. Okay. So which will give it time to heal, and it'll heal a lot faster. Okay. So this is very important, and most people don't want to take the time or spend the time to understand the condition. So once you understand the condition, then you can start to do more of these things, and it'll help your recovery much faster. Okay. I hope you found this helpful, and these are just some simple tips to start thinking about, and you can implement these yourself. And leave a comment if you have any questions, and don't forget to subscribe to the channel. Thank you.